Good evening and welcome to the August meeting of the Pitt County Board of Health. I'd like to welcome our TV audience. Our first item of business will be public comments. Are there any comments from the public tonight? Hearing none, let's go ahead and move to the minutes of the previous meeting. Those have been distributed and should be in front of you. Are there any corrections or additions to those minutes? Yes, sir.
Yeah, it shows me as present and I was not here.
You were not here, okay.
No,
All right, thanks.
Thank you.
Any other corrections or additions? Is there a motion to approve with
So
that
moved.
change? So moved. Is there a second?
Second.
All right. Any further comments? All in favor say aye.
Aye.
Any opposed? All right, the minutes are approved. We'll move on to the fiscal report. John Reed.
Thank you, Mr. Chairman, board members. The financial report you have in the packet and the one I'll discuss tonight is the final year-end fiscal year 2017 financial report. Just broad-based, we did not draw down any of our budgeted fund balance of $884,000. In addition to that, we not only needed to draw down that, we returned $546,000 to the general fund. So while some of that surplus was generated by some unbudgeted revenue, a significant part of that surplus return to the fund balance was generated by vacancies we had throughout the year in our department. We probably averaged between 12 and 14 vacancies throughout the year, which means, well, we don't have the associated salary and fringe benefits to go with that, but it makes it tougher for us to fulfill our mission. So just briefly on the report, if we can just kind of go down the line, the Medicaid revenue, we had budgeted about $283,000 for that, and we came in about $23,000 over budget. The Medicaid, we say PM, that's Medicaid revenue that we generate not through the standard fee for service, but it's a per member per month based on the Medicaid population that we serve. So that came in slightly over budget, about $16,000. We finally got from our 2015 Medicaid call settlement the 10% holdback. That was $40,000. That was not budgeted. And also we have accrued into fiscal year 2017 the budgeted amount of our 2016 call settlement. We have just received last month notice that we will be getting that $266,800 plus probably a little more, maybe $40,000 more. That's still a bit iffy. I wanted to be conservative in the financial report, so I left it at our budgeted amount. You also notice the $345,000 related to the settlement. That was an unbudgeted revenue from the state, which was designed to mitigate the effect of how the Department of Medical Assistance calculated our Medicaid cost settlements. They did a formula change, and it was detrimental to the public health departments. So this was a piece of legislation that the state enacted that gave us one-time revenue of $345,000. And I'll talk a little bit more about the Medicaid cost settlement after this report, because we just got some updated information last week. Clinic fees were about $7,000 under budget. Environmental health fees pretty significantly over budget by about $34,700. That really is a reflection of the increased construction going on in the county. Our environmental health, especially the on-site wastewater folks, have been really busy and are kind of backed up now with all the construction going on. The county funding, the county budgeted $4.6 million, and they only had to actually fund us about $4 million, so that's where that $546,000 surplus gets reflected. Again, we didn't have to use any of our fund balance. And in the other, those are private grants, and you'll see that we budgeted $800,000 for private grants. We only brought in $576,000. The reason for that is that we were able to allocate some state funding in two programs to help support our nurse-family partnership. And so we drew down that state funding to support the partnership, and that allowed us to conserve that much private grant funding going forward into this current fiscal year. And as you can see, our personnel cost $800,000 under budget. Again, that's a reflection of those vacancies. Mr. Chairman, I'll be glad to answer any questions. I kept saying the last half of the year we probably have a $400,000 surplus. I'm happy to say we have a little bit more than that. I'm not so sure I'm happy for the reason for the surplus, but that's where we stand.
Thank you, John. Does anybody have any questions for John? It's certainly good to see that settlement money come in. I know that's been a question of contention.
Well, after we vote on this report, I'm going to let another shoe drop, unfortunately.
Yeah.
Okay. We'll need to go ahead and approve this, or a motion to approve.
So moved.
Second. All right. Any further discussion? All in favor say aye.
Aye.
Any opposed? All right, budget's approved. Part two.
Part two. We got notice last Friday, late Friday, that the DMA had the court case between Cabarrus County and the Division of Medical had been settled in favor of the Division of Medical Assistance. So the revamped formula they used on cost settlements stood. So we're clean on all the cost settlements except the 2013 cost settlement. We received, the original cost settlement had Pitt County Health Department getting $790,000, which is, based on what we're now receiving, is significantly more than that. They held back 10%, so they actually cut us a check for about $711,000. With the reformulation for all the health departments, it looks like the potential payback that they overpaid us was about $451,000. So all the health departments are in the same boat. The North Carolina Public Health Association, we're having a webinar tomorrow to address ways we can mitigate that potential payback. And there are some things that we can do. One of the issues with the cost settlement is how it's called the Medicaid population, Medicaid-based population, or statistic, how the DMA calculates that. So we have the potential to go back, and they call it scrubbing some data to make it line up more with the DMA's theory. And so we're hoping that's going to mitigate the potential for that payback. At this time, it's just too early to tell. But we'll move forward best we can with it.
All right, any questions about this last report?
I just reiterate too, Mr. Chairman, the $345,000 that John mentioned that we got from the North Carolina General Assembly was meant to help us mitigate that potential payback too. So our hope is that we'll at least break even. Once we put the 345 in and we scrub the data, that we won't end up owing a lot more back to the Division of Medical Assistance.
So I was just say all 100 counties are in the exact same boat. It's nothing done at the county level. It was really based on a revised formula.
I guess the other piece of that, John, I don't know, you may have said this, after they settle us on the 2013, then they'll also give us the 10% holdback that on the other years that they haven't given us yet. So
Correct.
that would be an additional to the 345 that we got.
Right.
Well, very good. Thank you for keeping us up to date on that, so, and staying on top of it. Okay, first, we'll move on to a new business. We're going to have a series of reports. The annual State of the County Health Report tonight. We've got a number of speakers. Certainly, if any of the board members need to take a short break or something, maybe try to do so in between speakers. And so we'll start with the SOTCH background and leading causes of morbidity and mortality by Amy Haddam.
Good evening, board members and Mr. Chairman. We're excited that we can finally share the results of the 2016 State of the County Health Report, better known as SOCH. Just as a reminder, you did receive a copy of the preliminary report back in May, but it was preliminary because it had not been approved by the state health department at that time. So we did submit it. It was approved as written, but we did make a few minor edits. We had an email address in there that was incorrect, and we kind of realigned some of the graphics and so forth in there. So the copy you received before, if you can discard that one, and the ones you have in your packet tonight is the final edited version. I do need to call to your attention that on the back of the report, it does have the Board of Health members listed. However, it doesn't have our two newest members listed because at the time the report was written, you had not become part of the board at that time. So for our 2017 SOCH report, we'll update that with new board members, and that one will be published in March of next year. So tonight's report will be given by several health department staff and our community partners, and will also include our annual communicable disease report. So since we have such a long report and so many individuals that are presenting, if you don't mind holding questions till the end, I think that'll help us move through a little bit more quickly. And for the community, I'm sorry I forgot to introduce myself. I'm Amy Haddam, Health Education Director at the Health Department, and oversee the Community Health Needs Assessment as well as the State of the County Health Report, along with numerous partners that you're going to hear from tonight. So to give you some background, the SOCH report is prepared annually and linked to the county's Community Health Needs Assessment that we really call the CHNA for short. The assessments are required by both not-for-profit hospitals. It's required by not-for-profit hospitals by the IRS, and also required by the state health department for local health departments to assess the health of the community's needs every 3 years, and that's part of our accreditation requirements. And we have a partnership between the health department, Vidant Medical Center, Pitt Partners for Health, and East Carolina University with pulling together the Community Health Needs Assessment as well as the annual SOCH report. So the SOCH report contains the most recent secondary data, like our leading causes of death, which I'm going to cover with you in just a few minutes. It also contains annual updates on activities that have been implemented since we published the Community Health Needs Assessment and selected the priority health goals. So primary and secondary data drive our work. So to give you a definition of that, back when we were preparing the Community Health Needs Assessment in 2015, we conducted listening sessions in the community. We had opinion surveys among community groups. We also had an online community opinion survey. We used all of the feedback that we received from all of those modes of information to help determine our priority areas that are addressed in the SOCH. And that's how y'all came together as a board and selected those areas. Secondary data that we use is collected from numerous sources. The main source that we use is usually the North Carolina State Center for Health Statistics. But I do need to remind you that statistics are generally at least 1 year or more old because it takes a while to collect the information and for our sources to analyze it. Moving into the leading causes of death. For 2015, as you can see, our leading causes were cancer, these are the top 10, heart disease, stroke, chronic lower respiratory disease, all other unintentional injuries, Alzheimer's disease, diabetes, septicemia, motor vehicle injuries, and chronic liver disease and cirrhosis. So a few changes since that information was published in the assessment. So since 2015, there's been updated data for the leading causes of death. So cancer rose to the #1 cause of death in Pitt County in both 2014 and 2015, surpassing heart disease. Cancer rates climbed from 134.3 per 100,000 population in 2013 to 154.5 per 100,000 in 2014, and then even further to 164.4 per 100,000 population in 2015. So giving you just a breakdown from the leading causes of death, how they're ranked each year, a few things I wanted to point out to you. If you look in 2013, you see I have diabetes highlighted there in green. What I wanted to point out there is we hope we've made progress in this area, because in 2013, diabetes was ranked as the number 5 leading cause of death. But it dropped to number 7 in years 14 and 15. So we hope that can be attributed to some of the programs we have in place, like the Diabetes Self-Management Program or diabetes prevention programs that have been in place in the community since that time. So we're hoping that that has been part of the success with that. Also, I wanted to point out, you see highlighted in blue under 2013, all other unintentional injuries was number 6 in 2013, but that rose to number 5 in 14 and 15. And we think that that might be linked to a rise in prescription drug abuse or misuse, with that showing that it climbed a bit. On Alzheimer's disease, as you see, that's highlighted as number 7 in red under 2013, it also rose to number 6 in 2014 and 15. So maybe areas to consider addressing for the next assessment when we start analyzing or collecting additional data. So as was said before, cancer was the number 1 cause of death in Pitt County in 2014 and 2015. This just shows you the projections of new cancer cases and deaths of selected sites by the North Carolina Central Registry. So the cancer type, what was projected for 2016, lung cancer, 123 new projected cases with 86 projected deaths. Female breast, 151 projected new cases, 21 projected deaths. Prostate cancer, 106 new cases, 13 projected deaths. And then colorectal cancer, 65 new cases with 23 projected deaths. So additional data that we include in the assessment. This is based on hospitalization data for the hospital for VITA. So the top reasons people were hospitalized in 2014. Cardiovascular and circulatory diseases were the top, with 66% being heart disease and 18% stroke, followed by digestive diseases, and then other diagnoses and mental disorders are also clumped in with that, but it's not defined as to what all those other diagnoses are. Injuries and poisoning, there again, that includes probably opioid, prescription drug use and abuse in there. Infectious and parasitic diseases, and 82% of that was due to septicemia. And then the last one that I pulled out was respiratory diseases, 30% due to pneumonia and flu, with just a reminder to the community that we're getting ready to enter flu season again, to get your flu shot. Can never say that enough. Excuse me. So I want to mention to you tonight that the SOTCH report does contain activities from numerous community partners. But tonight we're going to share just a few of the activities that are highlighted in the report that are performed by health department staff and members of Pitt Partners for Health, and many of them you're going to hear from tonight. So just to remind you, the Board of Health selected priority areas that were selected back in 2015. Tonight you'll hear information about maternal and child health activities, tobacco prevention and control, and sexually transmitted diseases. There were other health priorities selected by Vidant Health and Vidant Medical Center, which is the flagship hospital for the Vidant Health system, and by Pitt Partners for Health, and they include chronic disease prevention, physical activity and nutrition, and access to care. So I'm going to turn it over tonight to Jennifer Hardy, who's going to start us off with maternal and child health information with a focus on infant mortality, and then each speaker will come up and they will identify themselves when they come up, introduce themselves. So I'll turn it over to Jennifer. Thank you.
Thank you. I'm Jennifer Hardy. I'm the coordinator of Women's and Children's Health Education Programs for the Pitt County Health Department, and so I'll be speaking with you tonight on maternal and child health with the SOTCH report. So the goal is to reduce Pitt County's infant mortality rate to at or below the state's rate using 5-year averages, with special emphasis on reducing the rate among low-income African American women. And we do know that Pitt County has a long history of infant mortality rates that are higher than the North Carolina rates. And then also Pitt County's African American infant mortality rates are typically 2 to 3 times higher than the state of North Carolina's rates. And then also with Pitt County's Caucasian rates as well. As you can see on the graph, the 5-year averages have remained stable over the last few years. 5-year averages give a better picture of our overall infant death rate than year-to-year statistics give us, because they go up and down over the years. But we do know that there's still a huge disparity between the races. There are a few statistics that I'd like to share with you for the year of 2015. For North Carolina, there were 7.2 deaths per 1,000 live births. And then also with Pitt County, with our infant mortality rate, we had 9.7 deaths per 1,000 live births, which included 21 babies and also 1 set of twins in those numbers. And then the Pitt County infant death rate decreased from 13.2 deaths per 1,000 live births in 2014. A few more statistics with racial breakdown. We have the white non-Hispanic race for North Carolina, 5.7 deaths per 1,000 live births. And in Pitt County, we had 3 deaths per 1,000 live births. African American non-Hispanic, in North Carolina, we had 12.5 deaths per 1,000 live births. And then in Pitt County, we had 18.3 deaths per 1,000 live births. In our Hispanic population, we had, for North Carolina, we had 5.4 deaths per 1,000 live births and none in Pitt County. And then other non-Hispanic, we had 6.2 deaths in North Carolina per 1,000 live births, and in Pitt County, 18.9 deaths per 1,000 live births. And then Pitt County's white non-Hispanic infant death rate dropped from 9.3 per 1,000 live births in 2014. But Pitt County's African American infant rate increased from 16.7 deaths per 1,000 live births in 2014, so there was an increase. Pitt County does have several programs that are working to improve the infant mortality rate. PIMPAC, which you've heard me speak on before, is the Pitt Infant Mortality Prevention Advisory Council, which has continued to direct infant mortality reduction strategies in the community. And then PIMPAC has recently reorganized to focus on the collective impact model to further address infant mortality. Trainings have helped members to commit to actively work on PIMPAC's goals. Some of the other programs that we have that are working towards our infant mortality rates are the Better Beginnings Breastfeeding Program. That's a breastfeeding peer counselor program, and they support and encourage women to initiate and continue breastfeeding. We also have the Child Care Health Consultant Program. Those are healthcare professionals who work to improve the overall quality of child care in Pitt County that are licensed. And then the Child Fatality Prevention Team, that's a team of appointed professionals who review child death cases. Cribs for Kids, that's a safe sleep education program that assists low-income families in getting pack and plays for babies so that they can have a safe sleep place. And we've recently had a media campaign to highlight that program, and you may have seen that on WITN on the TV station. We've had a huge increase in the number of folks who are coming through our program with that, as well as LARC, which is a little bit further down on the list, which is long-acting reversible contraceptives. And those are long-acting birth control methods, including IUDs and implantable devices that are more effective in preventing pregnancy. So you may have seen both of those campaigns recently. We also have the Healthy Beginnings and the Healthy Start programs. Those are outreach programs that work to remove barriers to care and link women to services. We also have the Nurse Family Partnership Program. That's an evidence-based nurse visitation program for first-time low-income parents and children. We also have the Triple P Positive Parenting Program. That's a parenting program for all parents that teaches parents the skills that they need to raise confident, healthy children and teenagers and to build stronger family relationships. And then last but not least, the Youth Development Program. That's a program that gives middle and high school age children resources to focus on strengthening students' knowledge, skills, and behavior with the hopes of decreasing teen pregnancy. Thank you.
Good evening. I'm Allison Smith. I'm the Tobacco Prevention and Control Coordinator at Pitt County Health Department. And also, Pitt County is the lead county for the CDC core grant that covers the Health Director of Region 10. So before I go over the goals from the SOTCH report, I just wanted to remind y'all, and I know y'all are really aware of this, but historically, tobacco helped build this community, but it's still the #1 cause of preventable death and disability in our county, the state, and the country. And is a major contributor to some of the chronic diseases that Amy mentioned earlier, like heart disease and cancer and stroke. Okay, so the overall goal for the report is to reduce exposure to secondhand smoke in Pitt County's multi-unit housing by 10% annually, and eliminate tobacco products in Pitt County's community parks by 10% annually. Just a few statistics on why this is a big deal, but 1 in 4 people in the U.S. live in multi-unit housing, such as apartments, and many are affected by secondhand smoke. There's no safe level of secondhand smoke, and it can travel within different units in multi-unit housing and others such as apartments through doors, cracks, electrical vents, and plumbing. So the first goal, reduce exposure to secondhand smoke in Pitt County's multi-unit housing by 10% annually. We're partnering with public housing authorities and officials and technical assistance to help them implement smoke-free multi-unit housing policies. This involves working with landlords, resident managers, residents, and others regarding the effects of secondhand smoke. We offer listening sessions to them to make sure they have a chance to hear others' opinions, and it's a big deal because a lot of residents don't see that the dangers in secondhand smoke. So that's one of the big reasons why. And another thing is to link them with cessation resources. So for 10%, our goal is to impact 6,500 residents. Out of between 2009 and 2013, 65,000 residents living were in multi-unit housing. And we'll reduce exposure by getting the multi-unit housings to implement smoke-free policies. And another thing to point out and mention is that the NC Department of Housing and Urban Development just passed a rule that all multi-unit housing have to be smoke-free by July 31st, 2018. So that will definitely be a good contributor to reaching this goal. For the second goal, increase by 10% smoke-free or tobacco-free public places in Pitt County, in addition to multi-unit housing. In March 2016, there were 42 community parks in Pitt County, and none of them were smoke-free. So the goal is to get 4 parks by the end of this term to pass smoke-free policies. The Board of Health was presented with a rule in 2015, or the Board of Health presented to county commissioners in 2015 the rule to pass tobacco-free parks in the county, and the rule was declined. So now we're taking an individual approach going through each municipality. So one of the first parks we'll be working with is Aden. Other tobacco prevention and control activities. 5 Pitt County Health Department employees and practitioners were trained as certified tobacco treatment specialists and will be using information they learn to counsel patients and their family members regarding tobacco cessation. The 4-day training was supported by the infant mortality prevention funding from NCDHHS. And this will be a huge help to help the residents and others who need resources. For example, if multi-unit housing residents need cessation resources, this will be a huge help for them. Thank you.
Good evening, Mr. Chairman and members of the board. My name is Kimberly Hardy, and I'm the Personal Health Division Director and Director of Nursing at the Pitt County Health Department. So our focus is on sexually transmitted diseases. Our goal is to reduce Pitt County's rate of chlamydia by 10%. Chlamydia is the most commonly reported sexually transmitted disease in the United States and in North Carolina. As you can see here, listed in this graph, and you'll see that a little bit better too in the next segment of the report that I will share with you, the numbers of chlamydia have actually, it appears that they have decreased, but that's not actually an accurate presentation. In 2011, there was a change in the reporting, so there seems to be a falsely high rate there. But as you can see, 2012, it kind of leveled off. And in 2015, we have increased with our chlamydia rates. The progress that we've made in terms of being able to address the STD problem is that we have continued to have our walk-in clinics on Monday and Wednesdays in our health department. That's for screening and treatment. We've actually found that 34% of our client services are actually administered through this clinic, which improves access to care for patients when they need them. It also decreases the interval from diagnosis to treatment as well. We also have youth development programs in the local middle and high school serving at-risk youth and helping to link them with services. And this is about prevention. We've also implemented evidence-based programs supported by research that will implement evidence-based programs such as condom distribution at sites in the community and group education for high-risk community groups. So we've had these type of interventions in our community before that was administered through our health department, and recently with the approved position for STD health educator, we will begin implementing these strategies again. The anticipated hire date for that is November. Now I'm going to transition over to the Pitt County Annual STD Report, and I am not doing this quite right. Let's see. Here we go. So our communicable disease activities are mandated by the North Carolina General Statutes, Chapter 130A, Article 6. There are several mandates within that article, but three in particular are charging us as Public Health Department and Dr. Marr as the local health department director. They're charging us to report all communicable diseases that are reportable, to investigate communicable diseases and issue control measures, and to exercise quarantine and isolation authority. Our CD program objectives specifically are to control the transmission of communicable diseases with appropriate prevention and treatment strategies, to detect cases of communicable disease in the community, and monitor the trends of those diseases that are occurring in our setting. The services that we provide within our local health department include the surveillance for reportable general and STD-related communicable diseases, and that may be via paper-based reporting or our North Carolina electronic disease surveillance system. We also provide prompt investigation of communicable disease cases. Jessica will talk more specifically about about probable, suspect, and confirmed cases. We also investigate outbreaks. Our services also include implementation of control measures, provision of post-exposure prophylaxis, provision of health education to the community, to enhance prevention and disease control efforts. We also maintain communication between our public health agencies, private physicians, hospital, and occupational infection control personnel. And we have a 24-hour, 7-day-a-week communicable disease response and reporting information available for healthcare providers. I'm going to begin the STD portion of this report, and I will be followed by Jessica, who will speak more specifically about other communicable diseases. The STD program goals within the communicable disease goals include to monitor the STD rates and trends in Pitt County, to ensure adequate treatment is given to all patients seen in Pitt County, whether they're seen at the health department or with private providers, and timely reporting to the state CD branch using, and in actually CDC, using the North Carolina Electronic Disease Surveillance System. Direct patient care services that we provide are confidential STD exams, confidential testing, confidential treatment, confidential counseling, and referral for treatment as indicated. I stress confidential here and have listed it 4 times to make sure that our community knows that they can come to us and have their health needs taken care of without threat of having their information being leaked or having a need for parental consent. In terms of our cases of STDs in 2016, we had almost 3,000 cases of STDs in Pitt County. 1,907 were chlamydia, so about 66% are chlamydia. And that basically explains why we're focusing on chlamydia with our community needs assessment and our SOCH report. We had 660 that were gonorrhea, and that's about 23%, followed by NGU, which is it's a way to diagnose chlamydia based on a series of parameters. And that's about 9%, and that's solely disease that affects the male. And then we had less than 1% of PID, and about 2% for syphilis. In terms of our demographic distribution of the STD cases, 62% of the cases are female, 74 in terms of gender. In terms of race, we have 74% African American, followed by 25% Caucasian, 17% Asian, and 5% unknown, and 1% Native Hawaiian and Pacific Islander, and about 3% were Latino ethnicity. This is what I was mentioning earlier in terms of seeing the trend for STD, specifically chlamydia incidents in Pitt County. We have experienced a pretty high peak of chlamydia here in Pitt County. For gonorrhea, you can see a steady upward trend as well for that. We had 664 cases this year. And as we move on to HIV and syphilis services, I mentioned that we do all the confidential testing and treatment, but we also do that for HIV and syphilis as well. We investigate the disease control measure violators and enforce the law with that. And we also assist with syphilis and HIV partner notification services. Our disease intervention specialists actually conduct that service for us at the health department. These are the numbers that we have for Pitt County for 2016 thus far. The report that usually comes out giving us the data report for North Carolina has not been released yet for 2016. But the data that we have available to us shows us that we have about 23 cases, and this is actually the 23 cases that we've managed and case managed at the health department with our disease intervention specialist. These numbers will look different to you next year when we look at these numbers. They will be higher. For AIDS, the same thing here. These numbers are not available to us yet, but in terms of what we've worked with the health department, we've had about 5 cases. You see a downward trend here with the incidence of AIDS, and that is attributable to the treatment that's available for HIV now that improves the outcomes from HIV. In regards to syphilis, we're kind of at a standstill for 15 and 16, although we are still, this is very concerning for our community to have our syphilis rates this high. Our needs for treatment and prevention are certainly confirmed with those numbers. Now, I will step out your way, and Jessica will come and continue the report.
Good evening, Chairman and members of the board. My name is Jessica Heath. I am the Communicable Disease Nurse Coordinator for the Communicable Disease Program in Pitt County. And I would like to present to you some of the data that we have collected for the CD program in Pitt County for 2016. I'm going to cover 3 different, sections. The first one will be foodborne diseases, the next one will be bloodborne, including hepatitis B and C, and then vector-borne diseases. Out of 63 total hepatitis B cases that were reported to the Pitt County Health Department, 9 of those were confirmed in 2016 as chronic, and 1 was probable chronic. I also had 36 that were previously reported for the first time in past years. 13 were out-of-county reports, and 4 were false positive results. Hepatitis C, we had 46 total hepatitis C cases that were reported. We had 1 that was a confirmed acute hepatitis C case. 34 did not meet case definition according to the state, which usually means they were considered chronic cases according to the state. They were 6 out of the county cases as well, and 5 were also previously reported. Campylobacter is a bacteria that can cause some pretty bad gastrointestinal issues in our population. In 2016, we investigated 11 confirmed cases and 4 probable cases of this bacteria. Salmonella is also a bacteria that can cause GI symptoms in the population of Pitt County. In 2016, we investigated 17 confirmed cases and 2 suspect cases. And I can say that I do anticipate that we will see a decrease in the amount of confirmed cases that I'm able to report just because of the switch over to the easier testing with PCR testing that's available now. Because it is considered a culture-independent test and it does not meet case definition for confirmed as of right now, as according to the state. The third gastrointestinal bacteria that I would like to report to you is Shigella. We had 5 confirmed cases and 1 suspect case in 2016. The first vector-borne disease I want to go over is Rocky Mountain Spotted Fever, and it is usually acquired from a tick bite. In 2016, we have 5 probable cases, but I also had 25 cases that were reported to me that did not meet case definition. Either they didn't have a fever or didn't meet the lab requirements. And 8 also were out of county as well. Lyme disease is also usually acquired by tick exposure. We only investigated 1 suspect case and 3 probable cases, and we also had 1 out of county case as well. The final vector-borne disease I would like to present to you is called ehrlichiosis. Thankfully, we did not have any cases that were reported in 2016. And I did want to cover some additional CD cases that were reported that were some new to me. I never actually investigated those before. We had 1 confirmed case of hepatitis A, 4 confirmed cases of Haemophilus influenza, 7 confirmed cases of group A strep, 3 confirmed cases of Legionella, 2 confirmed cases of Cryptosporidium, 1 confirmed case of dengue, 2 confirmed cases of Vibrio, and 5 adult flu deaths. We also had 1 probable case of tularemia, 1 probable case of Creutzfeldt-Jacobs disease, 4 cases of pertussis that were reported that did not meet case definition. Either they were tested for immunity purposes or other things. 1 case of chikungunya that did not meet case definition, and 2 out-of-county West Nile virus cases that were reported to us as well. And I'm going to turn it over to Lee Draper.
evening. I'm Lee Draper. I'm the immunization coordinator at Pitt County Health Department. Our goal in the immunization program is to eliminate vaccine preventable diseases in North Carolina. We want to reduce the spread of childhood diseases by ensuring individuals are age appropriately immunized, by managing outbreaks, and by providing health education to community to improve immunization rates and protection via cocooning. The health department provides immunizations at no cost to vaccine VFC eligible children, and VFC is the state federal fund program, which is vaccines for children. Immunizations for adults, we accept Blue Cross Blue Shield, MedCost, Medicaid, and we provide post-exposure prophylaxis for rabies. NCIR is the North Carolina Immunization Registry. That is the registry in which we at the health department and all pediatricians in Greenville use. The child's immunizations are put in the system in real time, and then the parents are given a copy of that shot record to keep. The state holds us accountable for an annual benchmark for the 2-year-old children. Let me back up. The immunization program compliance rate is defined as the percentage of children who have documentation of being up to date by 2 years of age with the 19 recommended doses of vaccine. And our benchmark program, we were at 95%. We exceeded the 90% goal. The county's benchmark is 79%, and they met 74%. And the health department is above the state average, and Healthy People 2020 goal is 80%, and that was met. Now I'll turn it to Kimberly Harlan.
So quickly, to wrap up the CD report, to review the TB program objectives, there, as they have always been, at least the last 5 years that I've been doing this report, our goal is to eliminate tuberculosis disease as a public health threat. Our objective is to reduce the number of new cases of TB and control the spread of TB into the general population. We provide TB surveillance, case and contact investigation, and direct and observed therapy, treatment of contacts, and isolation and other control measures. For 2016, we had 42 latent TB infections. Those patients were not infectious, so they could not transmit the infection to anyone because they were not symptomatic and did not have an active TB disease. But we need to treat them so that we reduce their risk of developing TB disease later in life. Our total number of new TB cases, however, was 4, and our total number of TB cases was 6. There are approximately 27 benchmarks for the TB program. This is important. The TB, controlling TB is extremely important. We've noticed a decline for the last several years with TB, but we are charged with meeting 27 objectives, and we met over 93% of those objectives in our program. In summary, to meet the charge that the state has given us to protect and promote the health of our citizens in regards to communicable disease, it's important that we have ease of access to quality health care, timely access to quality health care. We have increased community awareness and education regarding existing and potential health threats, and that we have community partner collaboration with those who are working in our public health system outside the public health department. Our communicable disease focus, I've kept the ones from previous years just to kind of show you where we're going in our efforts to improve our services that we provide and improve our efficiency of providing this protection for our community. In 2017-18, we are aiming to increase the efficiency of our clinic services. One of the ways that we're going to do that is we are actually doubling the number of enhanced role registered nurses who are able to conduct screenings for STDs in our clinics. And we are also implementing EHR very shortly. We also are improving our outreach efforts for prevention and early treatment of disease, and that will be done through our internal collaboration with our health education department. This slide here is just a brief display of the staff that it takes to make this program function. Now I'm going to turn this back over to the SOTCH report.
Good afternoon, or evening now. My name is Robin Tant, and I am Nutrition Program Director at the Health Department, and I'm also the Vice Chair for Pitt Partners for Health. Today, I am presenting on behalf of Pitt Partners for Health Chronic Disease Action Team. I do want to recognize that the co-chairs are Joan Mansfield and Sandra Hickman. There's so many projects and things that the Chronic Disease Committee is working on, but I will be highlighting one of those initiatives this evening, and that is the Community-Centered Health Home, building partnerships that connect community homes to healthcare settings, and this is the West Greenville Health Initiative. We know that chronic disease exists in all communities, but the reason that we chose West Greenville is that it has showed the largest rates of this chronic disease and the area that we believe that we can make the most impact in. Just to give you a little bit of background about how this all became, we started back in December 2014, where we had several community partners that were selected to take part in a Blue Cross Blue Shield Foundation Centered Health workshop. We did receive a $15,000 seed grant, and that was actually to do things that were targeted for diabetes prevention in the West Greenville area, again, due to the poverty, due to the chronic disease, and the increased emergency room visits that were there. We had many engaged partners throughout this whole process, Pitt Partners for Health, ECU, Vidant Medical Center, the Lucille Gorham Intergenerational Center was instrumental, and also the Health Department. And we all met and we discussed the next steps. And one of those things that emerged first was that the Pitt Partners for Health Chronic Disease Committee and Action Team, they held conversations with the leaders in those areas, and they wanted to gain perspective on what those leaders thought would really be helpful. And some of the conversations actually revealed some of the following things. Having to offer additional resources to existing agencies, such as technical assistance would be helpful, such as grant writing, identifying those grants that they were writing about, getting involved in their current programs, establishing relationships. Trust came up over and over in the things that we were going to do. Reaching out to the faith-based organizations, that was widespread. And finding out who those leaders in the actual communities were, so the individuals that actually lived there, so that was important. And they didn't want to be treated like a project, and that came out with not only the leaders but the community that I'll talk about in a moment. And they wanted to be heard. So again, we started December 2014, so this is sort of a timeline, but moving on to March 2016, with assistance from the CareShare Alliance, our partners met and decided to step back. The reason for that was that we were focusing on diabetes prevention, and though it was very important and still is important, we knew that that we needed to let the community tell us how they felt and what they wanted to work on. The other question that we wanted to determine was there a perceived need for something like a West Greenville Health Council? And that would be community driven. That was a key word. And we had a student that helped us with street intercept interviews, basically random conversations in the community, and that was done by ECU Public Health student. And again, through this process and with our partners, our team partnered with Drs. Nancy Winterbauer and Beva Das. Dr. Winterbauer is with the ECU School of Public Health, and Dr. Das is with the School of Kinesiology. And they helped us by facilitating these sessions with these listening sessions that we were going to do and completing a formative evaluation to present to our partners. And just to give you an idea of some of those street intercept interviews, the random conversations that I'm talking about that the student did, the participants noted that there is a misconception that West Greenville is a bad part of town. In fact, they really express pride in their area. There needs to be better understanding of West Greenville. Generally, there is no one person or one agency that the community feels that they could turn to with a neighborhood problem or issue. Elderly particularly lack resources, transportation, programs. Police presence was discussed, and also physical activity reference. There are basketball gyms and courts in the community, but other than that, they felt that they didn't have much that they could do with physical activity. So now we move into the listening sessions that I referenced a little bit earlier that Drs. Winterbauer and Das assisted with. During November 16, there were listening sessions held at the Lucille Gorham Intergenerational Center that I mentioned, Carver Shepherd Library, Community Crossroads Center, and Moywood Housing. The groups were comprised of interested people that lived in the community. They were knowledgeable and they were willing to talk with us. And the agency staff helped us identify those people, so we were collaborating with them the whole time. There was a total of about 34 people who attended the sessions, usually 8 to 10 people at each of them. So I took a little excerpt from the presentation that Dr. Das and Winterbauer presented, some of the strengths and some of the challenges. So some of the strengths: friendly, supportive residents, community agencies, police presence, crime has gotten better over time, and the neighborhood aesthetics has become better too. Some of the challenges, again, police interaction was talked about. Racism and profiling were still felt. Drugs, unemployment, elderly isolation, health education, access to care, and again, over and over, the whole trust issue came up. Again, many people in the area of West Greenville at each of the listening sessions that were held stated that they didn't want to be treated like a research project. They wanted to be, treated like people, and they didn't, if something was going in, they wanted it to stay in. They didn't want it to just come in and go away. So after the listening sessions were held, we held a community forum, and this was an invitation to all of the community to attend. This was held at Epps Community Center, and this was done in December 2016, and it was facilitated by Dr. Sheila Bunch with the ECU School of Social Work. And at that forum, a lot of good discussion. We had over 35 people there, which was really good for the time of the year, so we were happy with that. But the top health priorities that the community came up with themselves were mental health, depression, diabetes, obesity, heart disease, bloodborne illnesses, substance abuse, such as drugs and alcohol, cancer, and teen pregnancy. And with what they did, they actually voted with their feet. So they came up with the ideas, and then people voted. And these are actually in sequence. So the group consensus from the forum, good foundation for community-driven improvement initiatives that exist in West Greenville. So overall, people wanted to have something like a West Greenville Health Council. However, they wanted it solution-focused. They didn't want to just talk about things. They wanted coordination of efforts. They wanted to work through churches and community agencies. There was some discussion about possible compensation. But again, the challenge was trust that we had talked about. And I had been to all of those listening sessions, and it's really a nice thing to see when the relationships start to build and the trust starts to build, because that has really made a difference in what we've been doing and continue to do. Thank you.
Good evening again. My name is Mary Gaskins, and I am a nutritionist in the Cardiovascular and Pulmonary Rehabilitation Program at Vidant Medical Center, and I'm the chair of the Nutrition and Physical Activity Action Team of Pitt Partners for Health. I'm very excited to be here tonight to tell you about some of the wonderful things we're doing to promote better health in Pitt County. Nutrition and Physical Activity Partners is an active bunch of dietitians, nutritionists, health educators, exercise specialists, and a variety of health educators and health-related professionals, and we have lots going on all year long for people of all ages. We meet monthly on the third Thursday at 8:30 in the morning at the Pitt County Community Schools and Recreation Center at Alice Keene Park. For more information, feel free to call me or our coordinator, Stephanie Keene. And their numbers are shown here, or those numbers. So, in regards to health, if you would think about all the health-related issues around us that are affected by nutrition and physical activity, it's quite amazing. Heart disease, diabetes, obesity, hypertension, arthritis, osteoporosis, cancer, and I could go on and on. The possibilities for improvements are endless. I'm very pleased to report on some of the areas that we're working on to help promote better nutrition and physical activity and overall better health in Pitt County. One of the main things we've been doing are called Cooking Matters at the Store grocery tours. We hosted 12 Cooking Matters at the Store tours this year at local grocery stores during National Nutrition Month in March. These tours were made possible by a grant from Vidant Health Foundation and are designed to teach participants healthier eating on a budget. Because who hasn't heard? It costs too much to eat healthy. Well, we think it costs too much not to eat healthy, as good health is priceless. We have also proven to almost 400 participants over our 4 years of doing these tours that you can make a meal for 4 people or buy a healthy food from each of the food groups for $10 or less. And yes, it can be done. We've also added to this group an additional option called a pop-up grocery tour. This takes the same information about healthy eating on a budget to a larger group, or it's useful for those who are physically unable to stand in a grocery store for an entire tour, which is around 2 hours. Both of these have been well received, and we hope to continue doing similar tours in the future. Another piece of the same grant is the Farmers Market Nutrition Education Program. This is held each summer at the Leroy James Farmers Market on County Home Road across from Alice Keene Park. This summer program provides visitors a chance to sample local produce donated by the local farmers in a tasty and healthy recipe. They also get to pick up the recipe and take it home to try it. The FNEP, or the Farmers Market Nutrition Education Program, was held on 17 Saturdays between May and August of 2016, and we actually distributed one of our highest ever number of samples, 4,714, to be exact, I think. I'm just kidding. Our coordinator for that program is hard at work again this year, and we are also working with the Expanded Food and Nutrition Education Program, or FNEP, to target kids at a Kids Corner, which is also held once a month. The Farmers Market Nutrition Education Program has been very successful, and many of the farmers who participate and donated produce have reported selling out of the item that's featured in the recipe samples. This year, we've also added a variety of educational sessions, also in an effort to help teach people healthier eating on a budget, and we've focused on tips and ideas for food preservation and decreasing food waste. You've probably all heard, no farms, no food. So in keeping with that, several of our Action Team and Pitt Partners for Health members are also involved in the newly created, missing a slide, in the newly created Pitt County Farm and Food Council. This is an exciting new venture that we plan to continue to be a part of as it works to promote, advocate, and educate on food-related issues that deal with food from the farm to the store, to the table, to the compost pile, or the dump. Another healthy lifestyle message that we have promoted is Food Day. And each October for several years now, we have done something in relation to Food Day. In 2016, we held an event at Briley's Farm where we promoted our local track trails and the principles of Food Day, as well as multiple uses and the nutritional value of fall produce, much of which is available in our area, especially pumpkins. In October 2015 for Food Day, our Action Team provided Cooking Matters at the Store tours for participants of The Village, which is a program offered through FNEP as well. Speaking of track trails, we are also working on this initiative along with the Chronic Disease Action Team of Pitt Partners for Health, and are working on enhancing the use of our two local Kids in Parks track trails, one of which is at Alice Keene Park, the other is at River Park North. So far, our teams have increased awareness by speaking to multiple community groups, the leaders of the Boys and Girl Scouts, plus we have promoted track trails at local schools, summer camps, and a variety of groups for children and their families. A Get Active video, currently available on YouTube and Pitt TV, are available. Promotional banners and signs with a QR reader have been developed, as well as toolkits with pamphlets and the possible incentives that a person who registers with Kids in Parks can obtain. We also share those toolkits when we speak with community groups just to show what options for incentives they may have. So if you haven't visited one of these trails, please go and sign up for the incentives, the program, log your time. There's no age limit on who can enjoy and benefit from them. We all know that physical activity is a wonderful thing. We're also joining local pediatrician offices in the future to use the Kids in Parks Track RX program, which is a special trackable prescription that can be given to a family to promote activity. And if they log on the Kids in Parks website and register that prescription number, it can be tracked and they can also receive additional benefits and incentives. We have also worked to promote an initiative by the American College of Sports Medicine called Exercise is Medicine, in an effort to encourage people to make physical activity a priority, just like taking a prescription medication. because after all, it is the only prescription with unlimited refills that will add years to your life one step at a time. There are many other programs that our action team consistently supports with our members. Some of them are Growing Up Fit. This is a monthly early morning segment held on WITN, which is used to promote family-friendly health initiatives, events that are upcoming, share recipes, and much more. Usually done based on seasonal things, current events, and current foods that are available. We've also supported a walk in the park, Senior Fitness Day, the Winning with Diabetes Yearly Conference, the East Carolina Injury Prevention Sports Safety Clinics, which are held for all 6th graders that teach about hydration and proper nutrition, and many more. We're always looking for new options as well. Lastly, our action team is working to address a high volume of requests that we often receive for speakers at health fairs, events, church programs, and other various health-related initiatives that are going on in our community. So we have started a speakers bureau that we hope to be able to share with community members who request services in hopes of better connecting health-promoting resources throughout Pitt County. I do thank you for your time, and I would like for you to please remember, nutrition and physical activity affect us all, and we are working to help make the healthy choice the easy choice.
Hi, I'm Kayla Hall. I am the Director of the Community Benefits Grants Program with Vita Health. Microphone? Okay, thanks. And I'm also speaking on behalf of Ron Gaskins and Mary Hall, who are the co-chairs for the Access to Care Action Team with Pitt Partners for Health. I think all of you have a copy of the SOTCH report in front of you, and there are several programs listed in the Access to Care section, which begins on page 7 of the SOTCH report, but I won't go over all those. We're just going to hit the highlights of some of them. One of the programs is a physician extender at Bernstein Center. It served 480 additional uninsured individuals in need of primary care services. And also in the SOTCH report, anything that's got a VH behind it is Vita Health funded through the grants program. The Health Assist program provided access to 29 people for endoscopy and colonoscopy and dental services, and I'll talk a little bit more about the colonoscopy screening grant. The Health Assist program provided access to over 1,200 people for specialty care services. That total donated amount exceeded over $500,000. And Access East and ECU physicians both have medication assistance programs that helped over 860 patients obtain $1,169,000 worth of prescription medications. There's another program which is new. It started in 2016, which is a partnership between Vita Medical Center and Pitt County EMS. It is the Community Paramedic Program. The partnership enables a community paramedic, who's pictured here, Jason Jackson, helps to increase resources to the healthcare resources to the area north of the Tar River. The program will provide a variety of services, and Jason will serve as an outreach partner, a care coordinator, and accountability coach. The community paramedic has access to a dedicated vehicle that is stocked with medical equipment and tools. He will use the vehicle to make house calls on individuals enrolled in the program, checking on their wellness, whether they need to have prescriptions renewed, and what other medical needs they may have. He has become very acclimated to the services in the community and will also connect program participants with other community services that improve their health and quality of life. The current area being targeted is part of a pilot program and was selected through a heat mapping process. The area showed up, which area north of the Tar River, due to frequent use of EMS, emergency department use, and hospital readmissions. The area has also been underserved from the aspect of available health care resources. And in addition to addressing medical needs, community paramedic can also refer program participants to other services such as falls prevention with Pitt County Council on Aging, emergency food assistance, and medication assistance. The Vidant Health Community Benefit Grants Program is a partnership between Vidant Health and our community. It is programs that take place outside of the hospital walls. The program was started over 19 years ago and with the goals of improving health for people before they have to be hospitalized for conditions that maybe they wouldn't have had to if they had improved education about their condition or more knowledge about disease prevention. The program does today, as it did many years ago, is provide education about disease prevention and share tools and techniques with people to successfully manage their chronic illness, increases access to care for uninsured and underinsured, and does this by locating programs directly in communities where people live, which helps to remove the financial and transportation barriers that individuals face. The grants program empowers the community by providing grants to nonprofit 501c3 organizations and public entities. And when we talk about public entities, we mean county governments, health departments, public schools, also city and townships as well. This program is very different. I think you heard Robin talk earlier about how we did not want to go into the West Greenville community and tell them what they needed to do. We wanted to ask them. And so what this program does is we're asking the community for their ideas on ways to improve health in their own community. And this is done through a formal process. We have a call for letters of intent and then full grant applications for organizations who moved on to that second step. Our focus areas, you also heard Amy talk about the Community Health Needs Assessment. Ours are based on the Community Health Needs Assessment, and they're the same as Vidant Medical Center, Vidant Health, and Pitt Partners for Health, which is access to care, be mental health, physical health, and dental health, chronic disease prevention and management, such as cancer, diabetes, stroke, and other chronic illnesses, and nutrition, physical activity. As Mary said, that's kind of that first step in prevention and also in disease management. We monitor the program through meetings, site visits, and mid-year and end-of-project reports, and we track the program outcomes through reporting. And we all know we love numbers, and especially grant managers, we really love numbers. We like to see that what the grants set out to do, that they are accomplishing those outcomes. And as I tell our grantees, it's very important that they track and report their numbers, which they do a good job of. However, I also request that they share personal success stories about some of their clients and the people participating in their programs. And if you'll indulge me, I won't be too long, but I'd like to briefly share a couple of the success stories that do have numbers but have success, personal successes as well. One grant is with the Pitt County Council on Aging. It's a Medicare Options Counseling Program. The program provides personalized counseling, problem solving, and enrollment assistance for Medicare beneficiaries. And during the grant cycle in 2016, the Council on Aging provided over 1,900 individual counseling sessions, resulting in a savings of over $1.6 million, and that's for Medicare beneficiaries just here in Pitt County. The success story is that an individual who had recently relocated to North Carolina from another state, she went to the Council on Aging seeking assistance with medication copays. She stated that some of her medications were not covered by her plan, and the physicians that she wanted to see would not accept the Medicare Advantage plan. The options counselor sat down with her and completed a plan comparison for the client and reviewed with her the differences between the original Medicare and the Advantage plan. The individual made the decision to return to original Medicare and enrolled in the Part D plan. She is now able to see her physician, and all of her medications are covered, resulting in an annual savings of $4,500 in prescription drug costs. And then also with Access East, the colon cancer screening project, there are 20 individuals that received colonoscopies, and this is a group of high-risk patients, but 13 of the 20, which is 65%, which is a high number, presented with polyps ranging anywhere from 3 millimeters to 8 millimeters, with one person presenting with a 4-centimeter mass on his colon. These individuals were able to have the polyps and the mass removed, and which gave them the advantage of having these precancerous polyps removed and less chance of it developing into cancer. And I have many more that I could share with you, but I know it's been a long evening, so I'll stop there. But if you ever want some success stories or hear some more, I'm happy to share those with you. And I'll turn this back over to Amy.
I wanted to thank Kayla and Vidant Health for the numerous projects that they fund, when you get a chance to look through the SOTS report, as Kayla had alluded to earlier, you'll see VH behind a lot of the activities. Without the support from Vidant Health, these activities probably would not be possible in our community. So there again, thanks to Vidant Health for that support. So our next steps, where do we go from here? Well, we're going to continue to work to meet our established goals over the next 2 years, because our SOTS report will run for the next 2 years. So we'll have another SOTS report that will be back here same time next year for 17 and 18 to let you know how we further have worked on activities to continue to meet the health priorities for our county. But in the meantime, we're going to also start next year collecting new data for the new community health needs assessment, because that needs assessment will be due again in 2019. And at that time, we'll be coming back to this board to ask you to look at the new data. There'll be the primary data, again, we'll collect from community members, as well as the secondary data that we'll look at and analyze. Bring that back to you and ask you to reassess. Do you want to keep the same priority areas, or does the data reflect other areas that we need to be working on? So that will be our next steps. We also want to invite you and the community to join Pitt Partners for Health. You've heard a lot of the great work that's been going on through the action teams through Pitt Partners for Health. Pitt Partners for Health members meet on the second Thursday of every month at 8:30. The locations do rotate throughout the county, so in order to get connected, Stephanie Keene, who is the coordinator for Pitt Partners for Health, her phone number is listed here, 252-847-8265, and she can send anybody information about the locations of meetings and get you connected. But it's a great way to join the efforts of making a difference in the health of our county. And we can turn it over for any questions that you may have now, or for the community who would like a copy of the SOTS report. They can certainly email me, and we will be posting it tonight, because we do have to ask for this board to approve the SOTS report. Once you approve it, we will post it on our health department website, and it will be also there for the community to access that way. So at this time, Mr. Chairman, I'd ask if the board could consider approving the 2016 State of the County Health Report.
Well, thank you very much for the excellent reports. Does any of the board members have any questions for Amy?
Or any of our partners?
No questions. Is there a motion for approval?
So moved.
Is there a second? Second. Any further discussion? All in favor say aye.
Aye.
Any opposed? All right, your report passes. And thank each of you very much for your excellent presentations and your contributions to the community. It's wonderful to see all the cooperation and collaboration going on among a diverse group of diverse groups, and we certainly look forward to hearing another positive report a year from now. A lot of optimism about the continuing cooperation to overcome a lot of these challenges that we have.
Thank you.
All right, well, let's move on to the health director's report. Dr. Morrow.
Okay, thank you, Mr. Chairman. I'll try to make this brief. I did want to bring the board up to date on a few things. The opioid crisis, which we're hearing a lot about nationally, is impacting our incidence of hepatitis B and C, and also HIV and AIDS here in Pitt County. Now that the state lab is helping us test for hepatitis C, they've been doing that now for a few months. We expect, though, that that's going to increase the number of people diagnosed with hepatitis C, so we expect those numbers here in Pitt County to also increase significantly as a result of that testing. We're going to work closely with physicians in the county to get these patients into treatment and hopefully cure them of both their infection and their addiction that's leading often to the hepatitis infection. We're also, after direction from the board in June, we're working with the Pitt County Coalition on Substance Abuse and with the North Carolina Harm Reduction Coalition to help get a safe needle exchange program going here in Pitt County. The General Assembly took action to approve needle exchange programs in North Carolina last year. So we'll hopefully have that working pretty soon. Also wanted to let you know we have a new state health director appointed a couple of weeks ago, Dr. Betsy Tilson. She's a pediatrician from the Raleigh area and comes with a good public health background. The State Secretary of Health and Human Services, Dr. Mandy Cohen, announced today the department's plans for Medicaid managed care that are scheduled to be implemented in 2019. We have about a month to contribute comments on that plan, and I'll be glad to share that information with you if you'd like. Just also wanted to update you on our electronic medical record implementation. We are getting close to getting that done. Vidant Hospital is launching the new Epic platform this weekend. I believe it's Saturday, and we'll be next after they get those folks on board. We're planning on a 60-day process of training and implementation for that system. On a sad note, our dentist for the Smile Safari Mobile Dental Unit, Dr. Moore, is notified us that he was retiring. Dr. Moore came out of retirement from Little Washington, where he practiced for many years to help us with our mobile dental unit, and has been doing that for a number of years now. But now he says it's time for him to really retire. And so we are in search of a new dentist, and I was just talking to Dr. Harrell here about seeing if we can find a dentist to help us out this fall as we go to the elementary schools in the county. That unit's been out at the Boys and Girls Clubs this summer while school was out. I've also talked with Dean Chadwick over at the dental school, and with Billy Williams, who's a dentist here in town and is also serving as president of the North Carolina Dental Society this year. So we're trying to do the best to recruit there that we can. Also want to let you know John Reed has notified us of his retirement, and he will be retiring at the end of September. And so we're currently recruiting for his replacement. And y'all know the work that John does, and we're really going to miss him at our department. We do have, John talked about the cost settlement payback. We're waiting to find out from the federal government on some Healthy Start funds. That was one of the programs that was mentioned tonight around infant mortality. We are hearing that the funding is coming, but we need some assurance that that funding will actually occur this fall. If not, we could be in a situation of cutting back on that program. And last but not least, Kristen wanted me to remind you that the Board of Health manual updates, there's some updates for your manuals that you should have. And there's also some training online that Kristen's going to send information out for board members, which is another part of our accreditation requirements. So that's it.
Thank you, Dr. Morrow. Does anybody have any questions for Dr. Morrow? Okay, is there any additional business? Hearing none, is there a motion to adjourn?
So moved.
For a second?
Second.
All in favor, say aye. Aye. Any opposed? All right, the meeting is adjourned. Thank you very much for your attendance.